Hi. So in this short video we are going to see an image based question. Okay. So here is the image which shows some dark bluish structures surrounding something that is pink in color, and these are the necrotic areas. Okay. So all these are the necrotic areas. So what does this picture depict? It is actually AZZOPARDI effect. So what is this AZZOPARDI effect and where do you get this AZZOPARDI effect? We will see it. So AZZOPARDI effect is actually seen in one of the most aggressive lung tumor, that is small cell carcinoma, which is also called as oat cell carcinoma. Remember, this has the strongest association with smoking, but here I would like to stress the fact that the most common lung tumor associated with smoking is actually squamous cell carcinoma. But the lung tumor that has strongest association with smoking is actually small cell carcinoma. It is a very highly aggressive tumor because of its very high proliferating capacity. And coming to microscopic picture, it will be comprised of small cells, that is the cells that are smaller 3 times the size of a resting lymphocyte. And coming to the borders, they will have ill-defined borders with a very scanty cytoplasm and a dark hyperchromatic nuclei. So all these 3 features will give an appearance like the cells touch each other, which gives us the classical nuclear molding appearance. Okay. Coming to the chromatin of the nucleus, it is salt and pepper chromatin, which is quite classical for many neuroendocrine neoplasms. And even immunohistochemical markers, you can see the neuroendocrine markers like synaptophysin, chromogranin, along with CD56, CD57, as well as BCL2 overexpression. BCL2 is actually an anti-apoptotic factor. So how AZZOPARDI effect develops? It's a highly proliferating tumor, which means the necrotic rate is very high. It's very simple. You compare 2 scenarios. There is a place where 10 people are going to run a race, and there is another place where 1000 people are going to run a race. The chance of falling and developing injuries will be more in the place where 1000 people are running. Similarly, when many cells are in the proliferating pool, the necrotic rate also may be very high. And in necrosis, as we all know, the contents will be released. One such content that is released is actually nuclear material, which is DNA, that stands for deoxyribonucleic acid. It is an acid, which means it will combine with the basic component of the HNE stain, and the basic component of HNE stain is hematoxylin, which is bluish in color. That is why this DNA takes a blue color, which gets settled on the periphery of the blood vessel, and that is why we can see dark bluish discoloration in the periphery of the blood vessel, and this is called as AZZOPARDI effect. So this is another image taken from Robbins where you can see this AZZOPARDI effect. I am just drawing a green line on the top of the AZZOPARDI effect. And we can remember the high yield points of small cell carcinoma like it with the letter S. So small cell carcinoma is comprised of small cells, strongest association with smoking, and cells will have scanty cytoplasm with the salt and pepper chromatin, and it will stain the vessel wall blue, which is called as AZZOPARDI effect. And one of the classical immunohistochemical marker that is positive is synaptophysin, and one of the most common paraneoplastic syndrome that can be seen in small cell carcinoma patient is superior vena cava syndrome. Thank you.